Okay guys, welcome to my channel Innovate. In this part of video, we'll continue to discuss the pathophysiology and morphology of edema. That is lecture number 1 from hemodynamic disorders. Coming to the reduced plasma oncotic pressure, the reduced plasma oncotic pressure occur in conditions like nephrotic syndrome. That is a kidney disease in which there is a hypoalbuminemia, in which there is a decreased albumin concentration. This can cause the decreased plasma protein and decreased oncotic pressure, ultimately causing the edema. Number two cause of this reduced oncotic pressure is cirrhosis of the liver, or there is a malnutrition, that is a continuous deficiency of protein in the diet, or any liver disease that will going to decrease the production of plasma protein that will going to cause the edema. The third main category of edema is due to lymphatic obstruction that we have previously seen. This lymphatic obstruction occur in lymphedema, or it can occur in the condition called flaresis, in which the elephantiasis condition can occur. It is a disease caused by a parasite in which there is an obstruction to the lymph node or lymphatic obstruction. Or this lymphatic obstruction can occur due to the surgical removal of lymph node. In any biopsy, in any surgical operations, when there is a removal of lymph node, then obviously the lymphatic drainage will be disturbed and the edema may occur. Now the fourth main category of edema is increased sodium and water retention, and this occur by activation of renin-angiotensin system. When there is a decreased blood volume, what happens in congested heart failure or other conditions that will going to decrease the blood volume. In this way, the blood volume is going to decrease, and there is a sensor to the angiotensin system to become activated, and then when this system activated, there will be increased sodium retention by the kidneys. And we know that water follows the sodium. So when there is an increased sodium retention, the water also increase and accumulates in the extracellular spaces, and there will be a edema. This may cause inflammation. The inflammation can also cause the edema. That is a localized type of edema. Okay, so this was all about the categories of edema. Now coming to the morphology of edema. Okay, so morphologically, how we can discriminate the edema. First, we have to know that there are two types of edema. Number one is localized edema, or number two is generalized edema. The localized edema occur in inflammation. Inflammation is a type of localized edema, while an anasarca, it is a condition in which the system get edematous. Whole the body system get edematous. We have previously discussed that this systemic edema can occur in congested heart failure. So that type of anasarca is a generalized type of edema. Now two more categories of edema are pitting edema and non-pitting edema. So what is pitting edema? It's simply the indentation that appear and persist when applying the pressure. When we will going to apply the pressure on the edematous area, there will be a pit or indentation will appear. That is simply a pitting edema. There are many other causes of pitting edema. Well, non-pitting edema is the pit when there is no pit formation or there is an indentation is not formed. There is a firm consistent edema is called non-pitting edema, and this non-pitting edema is mostly occur in lymphatic drainage obstructions. Otherwise, all the edemas are mostly the pitting edema. They are the localized and they can be generalized as this anasarca. Okay, now coming to some important morphological features of some edemas, and these are the chart that you will going to remember, and it will going to help you in MCQs, BCQs and your vivas. So I have made it easy for you guys, starting from cardiac failure. In the cardiac failure or CCF, what happens, the edema occur in the dependent parts of body that are legs in case of standing and sacrum in case of bed, and buttocks in case of lying. It may be due to right ventricular failure. Okay, congested heart failure or cardiac failure, right ventricular failure going to cause the edema in the dependent parts of body that are like sacrum or buttocks. Second one is the renal dysfunction or nephrotic syndrome. Here the edema can occur in all the body parts. That is, systemic type of edema can be seen. But first what happens, there is a periorbital region edema can occur, and then this edema will going to, you can say this edema is going to occur in all the parts of body. This is a characteristic feature of nephrotic syndrome or kidney dysfunction edema. Next one is the pulmonary edema. The pulmonary edema is due to the left ventricular failure or due to pulmonary infections. So we have to remember that left ventricular failure causes pulmonary edema, while right ventricular failure may cause the cardiac failure edema, that is in all parts of the body. Last one is the brain edema. Brain edema is very severe. Obviously, it's affecting the function of brain, and this is the localized or it may be generalized edema. It occurs in elephantiasis, obstruction to brain venous pressure or other conditions. This brain edema is characterized by narrow sulci and distended gyres. So guys, this was all about the edema. This was all about the lecture on pathophysiology and morphology of edema. I make it short and easy to review guys and to get it understanded. Now next videos we're going to continue the hemodynamic disorders. Thank you for watching. Subscribe for more. If you have any query, comment below, like, share and subscribe. Thank you for watching.